Did you know that more than half of all personal bankruptcies in the United States are caused by medical expenses? Yes, you heard that right. The cost of healthcare in the US is enough to send shockwaves through your wallet. It's no secret that the price tag attached to maintaining our health can often be staggering. From routine checkups to necessary treatments, every medical step seems to come with its own mini heart attack, at least financially speaking. Imagine this. You're working hard, paying your bills, maybe even saving a little. Life is pretty good. Then, out of nowhere, you're hit with a medical emergency. Suddenly you find yourself battling not just for your health but also against an avalanche of bills. Bills that keep piling up, threatening to bury you under their weight. And if you think having health insurance is the magic shield that will protect you from this financial onslaught, think again. Navigating the labyrinth of health insurance is a challenge on its own. Premiums, deductibles, co-pays, out-of-pocket maximums. It's like trying to decipher an alien language. And let's not even get started on the dreaded not covered clause. It's like playing a never-ending game of cat and mouse, where the cheese of coverage is always just out of reach. For many, this is not just a hypothetical scenario but a harsh reality. A reality where the quest for health becomes a journey through a financial minefield. A reality where the fear of medical bills competes with the fear of illness itself. Now let's take a moment to talk about those who don't even have the shield, however flawed it may be. The uninsured individuals for whom even a simple doctor's visit can become a luxury. For them, the healthcare system isn't just a complex maze, it's a fortress with its doors locked tight. So take a moment and let that sink in. Our health could be one of our biggest financial risks. But don't lose heart just yet. This is just the beginning of our journey into the world of healthcare. Stay tuned as we delve deeper into the maze, explore the inequality gap, and shed light on the groundbreaking treatments that are changing the face of healthcare as we know it. Ever tried to decode a medical bill? It's like trying to understand alien hieroglyphics. Now let's dive into the labyrinthine world of healthcare, where insurance nightmares are as common as the common cold. Picture this. You go to the doctor, they prescribe a medication and you're thinking, great, I'm on the mend. But then, the bill comes in. You're not just floored by the numbers, you're positively poleaxed. And the worst part? You can't even decipher what you're being charged for. It's like you need a PhD in medical billese just to understand it. And then there's the lack of transparency in healthcare pricing. It's like going to a restaurant, ordering a meal, and only finding out how much it costs after you've eaten. Talk about a recipe for indigestion. You wouldn't accept this in any other sector, so why do we put up with it in healthcare? Let's not forget the Herculean task of navigating the system. It's like trying to find your way through a maze, blindfolded, with one hand tied behind your back, and the walls keep moving. From finding a provider who accepts your insurance, to getting prior authorizations for treatments, to disputing erroneous charges, it's a never-ending cycle of hurdles. Consider this. A man once spent 3 months trying to get his insurance company to cover a life-saving surgery. Or the woman who was charged $5,000 for an ice pack and a bandage during an ER visit. Or the countless people who've had to choose between filling a prescription and putting food on the table. It's a roller coaster ride no one wants to be on, but almost everyone finds themselves strapped in at some point. The healthcare system is more than a maze, it's a multi-dimensional labyrinth with twists, turns, and dead ends at every corner. And the minotaur in the middle? That's the baffling bureaucracy, the hidden costs, and the endless red tape. It's clear that navigating the healthcare system can be a full-time job in itself. And not a job any of us applied for, but one we're stuck with nonetheless. So buckle up folks, it's going to be a bumpy ride. Healthcare, a universal need but unfortunately not universally accessible. Now this is where the plot thickens. We're all wired the same way, needing the same basic care to thrive. Yet, the gap in access to healthcare is like a chasm, deep and wide. Let's take a stroll down the socioeconomic lane. Wealth, or the lack thereof, plays a huge role in healthcare accessibility. Picture this. 2 individuals, same age, same health condition, but different bank account balances. One can afford the best doctors, the latest treatments, and regular checkups. The other? They might find themselves choosing between a doctor's visit and their next meal. A grim reality, isn't it? But it's not just about money. Location, location, location. It's as true for real estate as it is for healthcare. Urban dwellers often have their pick of the litter when it comes to healthcare facilities. But for those in rural areas, it's a whole different ballgame. They might have to travel miles, sometimes even cross state lines, to get basic medical attention. And these disparities don't just exist, they influence health outcomes. A person's zip code or bank account balance can sadly be a predictor of their health. Chronic illnesses like diabetes and heart disease are more prevalent in low-income communities, and rural areas, they're grappling with higher rates of infant mortality and lower life expectancies. This is the inequality gap in healthcare, the divide between those who can easily access care and those who can't. It's a gap that affects millions, leading to poorer health outcomes and shorter lives. It's a gap that's more than just unfair, it's a crisis, a ticking time bomb that could explode if left unaddressed. When it comes to health, the playing field is far from level. And until we recognize that and work to bridge this gap, health will remain a luxury for some, instead of a right for all. But it's not all doom and gloom in the healthcare world. Indeed, the realm of medical science is a beacon of hope, as it tirelessly works towards miracles that can transform lives. Let's begin our journey with gene therapy, a field that has seen incredible success. This revolutionary treatment involves modifying or replacing disease-causing genes to treat or prevent disease. It's like spell check for your DNA, correcting genetic errors right at the source. Imagine a world where inherited diseases like cystic fibrosis or hemophilia could be eradicated at the genetic level. That's the promise of gene therapy. Then we have immunotherapy, a game changer in the fight against cancer. Instead of the scorched earth approach of chemotherapy, immunotherapy harnesses the power of our own immune system to recognize and eliminate cancer cells. It's like training your body's soldiers to spot the enemy and take them down. This approach has seen remarkable results, transforming what was once a death sentence into a manageable condition for many patients. Let's not forget about the magic of regenerative medicine, where scientists are literally growing human organs in labs. Yes, you heard it right. Using a patient's own cells, they're able to grow heart valves, skin, and even bladders. This could potentially end the agonizing wait for organ transplants and the risk of organ rejection. It's like having a spare parts store for the human body. And finally, there's the rise of telemedicine, especially during the recent pandemic. The ability to consult a doctor from the comfort of your home, get a diagnosis, and have prescriptions sent to your local pharmacy is a game changer. It's like having a doctor's office in your living room. These groundbreaking treatments and technologies are giving us a glimpse into a future where healthcare is more personalized, more effective, and more accessible. However, the real challenge lies in making these treatments available to all, regardless of their economic status. As they say, necessity is the mother of invention, and in healthcare that's proving true. The real question now is, how do we make sure that everyone benefits from these medical marvels? Because in the end, good health should not be a privilege, but a right. So where does this leave us? Let's take a moment to step back and ponder on the grand scheme of things. We've journeyed from the shocking realities of our healthcare system, navigated the labyrinthine maze of insurance, explored the chasm of inequality, and marveled at groundbreaking treatments. But what does the future hold for healthcare? As we look ahead, we must ask ourselves, how do we make healthcare more affordable? We live in an era of unprecedented medical advancements, yet the cost of accessing these life-saving treatments is often astronomical. Is there a way to bridge this gap, to ensure that the fruits of medical progress are not just the preserve of the privileged few? Moving on, we come to another critical question. How do we make healthcare more accessible? Even in the most developed nations, there are pockets of society where access to healthcare is as scarce as a desert oasis. This isn't just about insurance coverage or the number of hospitals, it's about creating a system where everyone, regardless of their socioeconomic status, can access the care they need when they need it. And then, there's the question of ethics. As technology pushes the boundaries of what's possible in medicine, we must also grapple with what's permissible. Genetic engineering, artificial intelligence and diagnosis, machine-made decisions, these are not just scientific questions, but moral ones too. Where do we draw the line between innovation and intrusion? These are big questions, with no easy answers, but they are questions we need to ask, to discuss, and to engage with. This is not just a conversation for the policymakers or the healthcare professionals, it's a conversation for all of us, because our health, and the health of our loved ones, is at stake. So, let's start this conversation. Share your thoughts, your experiences, your ideas in the comments. Let's challenge the status quo. Let's imagine a future where healthcare isn't a luxury, but a fundamental right. Because at the end of the day, everyone deserves access to quality healthcare.